Hi, welcome back to another video. Because you clicked on this video, it is likely that you have had first-hand experience of how excruciating and frustrating back pain can be. And perhaps, even more frustrating than the pain itself, can be the experience of going to see your doctor in desperate need for help, only to be told that you should rest, take some painkillers, and come back in a month if the pain persists. In fact, that's what happened to one of my patients who told me that he went to see his doctor about his back pain, but was repeatedly told by his GP to rest, and months later, he was diagnosed with pancreatic cancer, which was the cause of his pain. So, when should you be concerned with your back pain? Well, watch till the end of this video, and I will share with you the 7 worrying signs that make it more likely that there is a serious underlying cause. If you like this video and find this useful, please click the like button. Please leave your comments below and share this video. Hit the notification bell so you won't miss any of my future weekly video release. Please also subscribe to this channel. This is completely free of charge, but will help the channel to grow. Thank you. Lower back pain is super common. Around 80% of the population will experience back pain at some point in their lives. Some people will be able to identify a trigger for the back pain, like lifting something heavy in the gym or some heavy lifting in the garden. But for many, lower back pain can seem to come from nowhere. My back pain started many years ago when I simply lowered a piece of luggage. The pain that I experienced was incredibly debilitating. I could not get out of bed in the morning and it stopped me from going to work. But the good news is that most back pain gets better with time, even without treatment. But my back pain recurred regularly. So I was naturally worried that something serious was going on. So, when should we be worried about our back pain? Well, broadly speaking, back pain can be divided into 2 categories. There is musculoskeletal back pain and pathological back pain. Pathological means that the pain is caused by an underlying disease process, like disc problem or cancer metastasis. Musculoskeletal back pain, on the other hand, is caused by a strain of one of the many ligaments, tendons, and muscles in our lower back. Most back pain are of musculoskeletal in nature, meaning that there is no structural or underlying pathology. It was simply caused by muscle dysfunction, typically due to the formation of trigger points, commonly caused by adoption of poor posture for a prolonged period of time. I've covered these topics extensively in previous videos, so please take a look. Because of the sheer number of nerves that run through the lower back, even a slight injury to these structures can cause excruciating pain. And because these structures are so close to one another, it can be difficult to pinpoint the exact source of the injury. Musculoskeletal back pain is the most common form of back pain, and perhaps surprisingly, the type that doctors worry the least about. This is because the majority of musculoskeletal back pain will improve with physiotherapy or get better in a week or 2, even without treatment. That said, unless the cause of it is identified and rectified, like poor postural habits, these type of back pain can recur very easily. And this brings me to the first sign that you should start to worry about your back pain. That is the duration of your pain. Now, what we are talking about here are the pathological causes of back pain. And this includes conditions such as infection, cancer, fractures, autoimmunity, and nerve damage. Luckily, overall, these conditions only account for about 1% of all people seeking a family doctor for back pain, but are important not to be missed. So the job of your doctor is to distinguish these conditions from musculoskeletal back pain. So, if your back pain persists beyond 6 weeks, then this could be a sign that there could be something more than just a back strain at play. And the second sign that you need to worry about is a progressive escalation in the severity of pain. With musculoskeletal back pain, many people will experience fluctuating symptoms. On some days, the back can feel quite good, but on another day, it can feel worse. Pain tends to be bad first thing in the morning, but as you start to move around, it gets better. But pain from pathological conditions does not behave this way. Once a problem has occurred, it continues to stay that way. No position makes the pain better, and the pains usually get worse. So pain that turns up and then continues to escalate over time is a sign that there could be an underlying disease process. The third sign is fever or night sweats that accompany back pain. Although infections that cause back pain are rare, they can occur in people who use injecting drugs, who are taking immunosuppressants medications, or those who live in areas where infections like tuberculosis are common. The fourth sign are people over the age of 50 who have developed new back pain. With increasing age, problems such as cancer and fractures become more likely. In particular, women over the age of 50 may experience osteoporosis caused by a significant reduction in bone density after menopause, putting them at a higher risk of fractures. The fifth sign you should worry about your back pain is when it is associated with unexplained and unintentional weight loss. That is because weight loss can be a side effect of cancer. Cancer is an uncontrolled proliferation of cells which compete with your body for energy, sucking up energy and cause people to lose weight. Some cancers can start in the spine, while others, like prostate cancer, can start elsewhere and then travel to the spine. The sixth sign are that people who experience severe spinal stiffness. These can be a sign of an autoimmune condition called ankylosing spondylitis that causes fusion of the vertebrae and lead to restriction in spinal movement. This condition can make life very difficult over time, so it is important for doctors to diagnose it as early as possible. The seventh sign is the evidence of nerve damage. In severe situations, they can include symptoms like urinary incontinence, constipation, numbness around the genitals and buttocks. In less severe situations, there may be changes in sensation in the lower legs and weakness in leg movements. These signs indicate that the complex web of nerve fibers that run inside and around the spinal canal may have been injured somewhere along their path. This could be due to a disc bulge pushing on the nerve root, or in severe cases, compression of the spinal cord itself. With bulging discs, often physical therapy is tried first, but in compression of the spinal cord, urgent surgery will be required. One thing to remember is that these 7 signs are not absolute indicators of serious back pain. In fact, research shows that some of these signs have a high false positive rate. So if you do have one or more of these signs, stay calm and get it checked from your healthcare provider. Many of you watching this video may be experiencing lower back pain that has lasted for more than 6 or maybe even 12 weeks. But your doctor has not found a pathological condition despite doing an appropriate evaluation. This situation is called chronic back pain, an incredibly frustrating and complex condition where the problem may have started in the back, but over time it has also caused changes within the body's pain signaling system. And there's no question that our modern lives encourage us to be more sedentary than generations before us. Unfortunately, this level of comfort has its disadvantages, one of which is a loss of flexibility. And yoga is a great way to improve joint mobility and to strengthen our mind-body connections. Let me just summarize. The intensity of musculoskeletal pain varies during the day, but the level of pathological back pain is consistent or may even get worse with time. And it is unusual for pathological back pain not to be accompanied with associated gastrointestinal or urinary tract symptoms such as constipation or incontinence, as well as weight loss or fever. Please remember that this video is for educational purposes only, and please consult with a healthcare provider if you're worried about your back pain or are about to undertake a new exercise program. Until next week, take care. Thank you for watching until the end. If you like this video, please click the like button. Please leave your comments below and share this video. Hit the notification bell so you won't miss any of my future weekly video release. Please also subscribe to this channel. This is free of charge but will help the channel to grow. If you're interested in improving your health and fitness or losing weight, if you suffer from or wish to prevent back pain, please take a look at my book, which is now available from Amazon worldwide. Thank you.